Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. Today I have a very special guest with me. But first let me introduce myself. I am Kurt Barwis, your host. I'm the president and CEO of Bristol Health. Today we have John Lodovico, who happens to be the chairman of the board of the health system. John, welcome.
Thank you.
And how about starting by, tell us a little bit about yourself.
Well, I always start off with, especially if we're in board meetings or if I'm talking to folks and they talk about Bristol Health, is that I've been around for a while. I was born at Bristol Health in 1951. That was 72 years ago. And been involved with the organization for a number of years. Started off on the facility board back in the mid-90s. Gradually worked up to the chairman of the facility board, and then in turn was placed on the main board itself. Strong believer in the health system, especially Bristol Health. It's amazing our 129-bed hospital, what it does for our community, and I always say that wherever you live in a radius of 15 minutes, even surrounding towns, you can make it to Bristol Health in the case of an emergency or to visit someone.
Yeah, your dedication and the fact that you have dedicated so many hours of your time. People always ask this question, so how much do board members get paid?
It's unbelievable.
It's unbelievable, isn't it?
The payment is satisfaction, knowing what you're doing for your community, knowing what you're doing for the organization, because it's a community hospital, and I think there's 4 of us left, if I'm not mistaken, 3 or 4 of us left. And I say it too, hospital business is a tough business to be in. It's a tough business to be in. But I wouldn't change it for the world. You have to believe. I always said, ever since I got out of service, you have to have a purpose in life. Yeah. And there's nothing wrong if someone just likes sitting home and going through their daily lives, or if you want to get involved. But it's a satisfaction, what you get out of it, that keeps me going.
Yeah, I think people, when I talk about governance, there's a lot of confusion about that, and I'm not sure people really understand the role and function of board members. And you pointed out you were on a facilities committee. Mm-hmm. So can you talk a little bit about that? What do board members do?
Well, I was placed on I was asked if I would be willing to sit on the facility board. That's my background. I'm director of facilities and project management at Tunxus Community College. I've been there going on 24 years. Prior to that, I was at the Gettin Insurance Company doing the same thing. So that's my bailiwick. That's what I know better than I know myself sometimes. So it's just that if you have an interest, if you have the background, I mean, Kurt, you know yourself, on our board we have a variety of different accountants, different professionals. We have a retired FBI agent. We have health professionals. We have community members that sit on this board. Yeah. It's a net of different folks that make our board so, and we have a great board because not one person. I'm only there because I have great folks around me that probably know a little bit more about than what I do, especially in the financial end of it. But we all work together. Everybody is on an equal level. No one's above, no one's below. Everyone is treated with respect. As you know, we joke on the board, and we have a good time. We have a good time.
It's it's really about your leadership style and the way you really facilitate, bring people together, John. I have to be honest with you. You're a phenomenal leader, and how you lead the board in deliberations, discussions about critical topics and things like that is really an art, and you do it very, very well. So I appreciate that.
It's just, thank you. It's just getting the folks involved.
Yeah.
There's so many good ideas out there, and it's just getting the folks involved and expressing their, because the bad idea is an idea that's not mentioned.
Yeah.
And maybe it's because of my background and when I was in the military. It's just that, we had a saying, I got your six. And the thing is it means he got your back.
Yeah.
And that's the way I feel the board is too. Everyone's there to help everyone. No one's there just to sit and have a cup of coffee and then go home at the end of the night. And we do have a lot of meetings. I mean, it was...
Yes, we do.
We used to meet as a board, full board, we used to meet once a month. Now it's once a quarter, but it's a subcommittee meetings that everyone is on that meet a couple of times a month, sometimes a couple of times a week. But you, as our CEO, you're able to adjust in terms of, we could do visual, we're trying to get more folks on board in the conference room, but it's hard. But it's the feeling that people want to get involved. I know everyone that sits on our board now is very, very involved, very involved.
Yeah. So in a sense, you have this incredibly dynamic group of individuals that represent, the community from different vantage points, different interests, and things like that, and really try to sustain the mission of that hospital, which is center in everybody's thought just about at all times. Right. Is how do we sustain that mission now after 100 and so many years? So you mentioned the committees. I'll go back to the committees again. So what are typical committees? What are the committees that we have that are always going to be there and are essential functions?
You have the Health and Safety Committee. You have the Finance Committee number one. We have our Partnership Committee. I know I'm going to miss some, Kurt, as I'm going along here, but it's just very, very important committees, and that's just a few of many. Yeah. That's a few of many.
Yeah, and so the board does a lot of its work through those committee structures, and those committees then bring their suggestions and recommendations to the board, the quality committee of the board, things like that. So the board is an oversight, but it's a fiduciary board, so it has financial responsibility.
Correct.
And how many employees does the board have that they report to them?
I'm not sure.
It's just me, right?
Yeah, that's right.
That's right. The only employee.
You threw me off on that.
Sorry, I'm sorry.
You're responsible to us.
I'm responsible.
Exactly.
To you, to
that's the way you framed it.
I'm sorry.
Threw a blank. No, that's fine. That's fine.
But, and I think that's also kind of something that's misunderstood. There's 1,750 employees in the system. Yeah. And you manage me, you control me, you hold me accountable for outcomes, quality, and everything else.
That's enough to normally.
That's totally true. But you're right. It is a lot of work.
Yeah.
And right now it's just an incredibly challenging time for health systems, for hospitals, as you pointed out. And part of the job of the board is to kind of look forward. And if I think about what the board's accomplished over the last couple of years during the pandemic, it's just incredible.
It's amazing.
You all led through a pandemic which changed us a gazillion times during it. While at the same time, you talked about the facilities committee, the accomplishments during that pandemic.
Look what we did. I mean, to cut you off, but look what we did during the pandemic. We modernized our emergency room completely. I mean, literally, the workers coming in they had to just sign every day that they were no fevers, whatever the CDC requirements were at the time. And we were able to, you were able to, with your group, to make sure this, and we have a state-of-the-art emergency room right now. State-of-the-art.
So the board, in that process, the board is the ultimate go, no-go decision maker for those kind of things. So that was $17, $18 million
Yep.
project,
Yeah.
and required financing,
Donors.
and lots of donors.
Lots of donors.
It's a really amazing donors.
Thank God for the generosity of our donors for that project, because it probably wouldn't have happened.
Yeah. So management pitched that idea, to do that, to, add to the ER, make massive changes to Newell Road, take over Newell Road, and all that stuff. And I think the thing that's really amazing about it is that the board itself has to actually look at all aspects of that project and decide, can we actually pull this off? Does it make sense?
And we did 2 phases, don't forget. It was phase 1, and then we had a complete phase 2. Because the hospital never shut down.
No.
Never stopped. Never stopped seeing emergency cases. 38,000 a year is an average of what we see going through those doors in the emergency room. We never stopped. Yeah. Phase 1 was moving phase 1 into phase 2. Phase 2 with the folks and then we had to bounce them back and complete phase 2.
Yeah. So as I kind of journey through the decision process, the first part was borrowing all the money. Yeah. The extra money that we needed. Yeah. So that, if I go through that in my mind, the decision process, management had to actually describe how we were going to do it, how much it was going to cost us to do it, the borrowing, how we were going to pay it back, all that kind of stuff. That all went to the board. Yeah. And the board had to get comfortable with that and then approve it. Yeah. And then the next part was all the architectural and engineering studies and cost estimates and all those things. So, going back to what you said earlier, it's a lot of work. Well, because there's a lot of responsibility, because you've got this incredible organization.
Just managing it through the board itself, between finance taking a gander at it and looking and going back to the main board. And there's so many different pieces. I have the engineering, everything are line items to me, boom, boom, boom. And you check the boxes as you go down. You're hoping you're checking those boxes. Yeah. But it was a very, very, I don't want to use the word cumbersome, but it was it wasn't an easy undertaking. It was not an easy undertaking, but we did it. You did it. We did it.
And one of the big things about healthcare is reliability and high reliability. And when I think about the board itself, it creates this second, kind of third and final check of reliability in what we do. And everybody has a piece or some knowledge that comes to the table. And you said the only bad idea is the one that doesn't get to the table.
Exactly.
You say that all the time.
You're right. Yeah.
And interesting, I saw the numbers Monday morning. We're actually still on budget for that project. If you think about how many years it took, and there was old construction, new construction,
oh my God.
Equipment, HVAC systems,
the site
engineering
work,
systems.
The site work was enormous.
Site work.
Moving the steam lines around. It was just an extremely huge undertaking. Undertaking.
And then the other, kind of big project that the board really had to struggle with and get approved was the downtown medical center. 15
Riverside Avenue.
15 Riverside Avenue. Yeah. So let's talk about that a little bit.
Sure.
That was a hard discussion.
Yeah.
I remember back, the medical staff actually wanted that medical center right next to the hospital.
Exactly right.
So how did that, it kind of morphed, into a whole different direction?
Well, I think with just showing the medical staff the toughness of putting it where they would like to have it, I think it was the political end of it too. We went through all of that. We went through all of that too prior to going, and putting it on that corner. I think once the more conversations we had about it, the more meetings we had about it, which you were very good at explaining, the renderings we had at it, the reasons why we needed it down there, and it was actually to rejuvenize the downtown too. It was a double-edged, not a sword, but a double-edged project that we needed. We needed a medical space. We needed an MSG group, the doctors to go there. And then also we wanted to revitalize downtown. You got to remember, how long did that property sit prior to us going down there? We've been down there now, 5 years? Time flies for me. 5 years?
It's at least that.
Five, 6 years. Yeah, 5, 6 years. And look at our downtown now.
And I think
we were the hinchpin. They got that going.
Yeah, it was a big project to undertake for us. And it's funny because I remember the orthopedic guys were all the whole team of orthopedics was in the hospital in the original entrance to the hospital. And they kind of pushed back and fought us.
I forgot about that.
Remember that?
Yeah, I forgot about that. Wow, that's right. That's right. Remember that? Yeah, that's right.
And so now I kind of play that forward. We just moved rheumatology and endocrinology back to the hospital, and they fought us not to go back.
Exactly.
We did it for the right reason.
Kurt, it's that thing, as you know better than I, is that human beings, they hate change and they hate being told what to do.
Yeah.
And not that anyone hated anything. It's just it was a change. It was a change in someone's life. But they had to be educated, if that's the right word to use, to say these are the reasons why this is a good thing to do. And you and your team were very good at doing that, along with the board. You know, because you had full support from the board. I wasn't chairman at the time; I was vice chair.
Yeah.
But you had full support of the board because in the beginning, I even had my doubts. I looked at this monstrous, and this is what I do.
I had my doubts going all the way through it, John.
And this is what I do, and I'm saying, oh my God, is this really going to work?
Yeah.
And then the more we got into it, the more we started understanding the reason why, and the rest is history. The rest is history.
It was not an easy process to navigate
No.
because that building was very expensive.
Yeah.
And it really did anchor that 17-acre property.
Yep.
In a way, and now look today where it is. I mean, it's
beautiful.
Just about all spoken for.
Yeah, it's beautiful.
And has created just tremendous economic development.
I think we got a couple of awards through the architects.
Yeah, we got lots of awards.
Yeah.
I'm not sure I really registered how beautiful that building was going to be. So
it's amazing.
But it was
amazing.
The developers had a great vision for it. So, so then, you know, talk a little bit about the process for the succession on the board. So a board chair, how long can you serve as board chair?
Well, a board chair, if I'm not mistaken, is two. It seems like I've been serving forever, but as board chair,
it takes a while to get to board chair. So
it's a 2-year plan, if I'm not mistaken.
Yeah.
Correct? And obviously, prior to being board chair, you're vice chair.
Yeah.
Okay, and usually before vice chair, you're sitting on one of the executive committees. You could be secretary, you could be the treasurer, and you know you're right. As a matter, in my case, thank God for Glenn Heiser, our past chair. When it was time for me to jump up, between my work schedules and a lot of other things, I just didn't feel comfortable because there is a lot of time that's spent. And we asked Glenn, and Glenn was graciously willing to sit for another term, just one term. And then, you know, and then I, you know, sat at the chair. And I tell you, I had my doubts in the beginning because of the time. I'm a time freak. I'm a scheduler. But it's probably the best board I've ever sit on. And I've sit on quite a few boards, as you know. I was on zoning in Bristol for 24 plus years. I'm trustee at St. Francis de Sales, our church. I'm heavily involved with the veterans groups. I'm a disabled veteran myself. So I've sit on quite a few boards. But Bristol Health, it's a challenge at times. How many times in the I don't want to say the middle of the night, but close to the middle, are we texting back each other with ideas? And I'm bouncing ideas off you, and you're bouncing ideas off myself. But it's such a. I want to, I want to touch on one thing. We have our President's Forum.
Yeah.
And I think this year we had 3 so far, if I'm not mistaken. One was pediatrics, one was cardiac, and then the last one we just had was partnering with the towns and the other agencies, social service agency, and the police department is the opioid crisis that we have in place.
Yep, the COBRA program.
Thank you. Which was started, I think, under the Zappo administration, Zappo-Sasso administration, and carried on with the current administration we have in place now, Mayor Caggiano. But it's something that I all came together.
Yeah.
Everyone talking with each other. Everyone knows there's a problem, and it's easy. Yeah, we got a problem. What are we going to do about it? What ideas came, and you could agree with me, I think, what ideas came out of that session? It was unbelievable. It was unbelievable. And this is what we're able to do as a community hospital. This is how strong it is. And that room was packed.
Yeah,
that room was packed with people. And people were asking questions. You know, and it just, I don't know. And this is this is why I enjoy sitting as chairman of the board.
Yeah, your point is so important that, it's not just the person who comes into the emergency room. It's not just the person who comes in and has surgery or needs an admission to the hospital or a diagnostic test, a lab test or an x-ray. The hospital is truly an organization. It's owned by the community. And its purpose and its role is beyond its four walls, as you just described so eloquently. It really does expand beyond. I want to go back to something else.
Oh, I'm sorry.
Thank you for your service.
I took you off track. I know. I'm sorry
that's
about
okay.
that.
But I want to thank you for your service. We have an important day coming up on Saturday.
Yep.
So can you talk about that a little bit?
Well, again, being a veteran, being a disabled veteran, I spent a year and a few months in Vietnam. Actually, it's a little bit of not Vietnam is not the joke. It's some folks. Did you join the service, John? I said no. I said I didn't join. I said it's probably the lottery I ever won, because at the time it was a draft.
Yeah.
And it was one of the lotteries I won. And he said, really? I said, yeah. My number was 1. And that's a true story. My number one. And I was still a senior in high school. But regardless, it's near and dear to my heart. I sit on the Veterans Council and I sit on Veterans Strong. I'm always, not only me, most veterans are there to help each other out. We all go through rough times. There's agencies out there that folks could go to, but it's just a very, very special day. And yourself, every Veterans Day, you send out a beautiful, beautiful thank you and respectful reminder of what veterans, no matter where you served, no matter what division or what unit you served in, it's just it's a special day. It's Saturday this year. Actually, I'm speaking. I'm going to get this right. I think at Shady Oaks. I think I'm giving a little presentation at Shady Oaks on Friday afternoon.
This city is really kind of great at recognizing veterans. On the boulevard, there's all kinds of tributes and things like that. And we should always remember those that gave.
I think Bristol's got the second highest contingency of veterans, 5,000, I think.
Yeah.
I could be off by a couple numbers.
Yeah, you can feel the strength in our community and the support and the love for the veterans who have really done amazing things.
The community, we have such a strong community of, we have an unbelievable police department. We have an unbelievable fire department. The EMT program that we have is just amazing. Bristol is a helping town. People are always willing to help someone out.
Yeah. So John, any last thoughts for the viewing audience, about your role, about the hospital, about the community?
My role in the hospital is that it's a very satisfying position to be in. If anyone is ever interested in getting involved, you don't need to sit on the board to be involved. You have the volunteer program. We have that volunteer luncheon once a year that we have 30 or 40 people that the hospital gives them out awards for their length of service. We have the recognition dinner for the employees, and we have employees there that have worked there 45 years. Oh yeah, a few. I mean that
they went right from the bassinet to
that's what I'm telling
work.
you. That alone tells you something. It's the culture that we have in this hospital. But getting back to the audience, in terms of if you ever want to volunteer, there are so many different agencies you can volunteer at. Bristol Health is fantastic for a good start.
John, thank you so much for your service. Thank you for your dedication to this community organization. It really wouldn't be the same without you.
Well,
so
there's
much
a lot of folks that do a lot of things. It's not only me.
You're an amazing leader, so thank you. This has been another exciting episode of Bristol Health Cares. You can write us with your questions and what you'd like to hear on this show at cares@bristolhospital.org. A special thank you to Nutmeg TV for their production of this show, their dedication to this show. It is a great organization, and I suggest that if you have the means, you should support Nutmeg TV with your viewing eyes and maybe your dollars as well. So again, until the next episode, thank you. I'm Kurt Barwish, your host. Have a wonderful day.